to present work that's a result of about 6 years of collaboration with the Ministry of Health in Zambia. And at the end, I'll probably show you, hopefully we'll get some time, I'll show you some of the other health experiments on the supply side.
Sorry, I don't think your mic is on.
Okay, let me turn it on. Okay, is it on now? Great. This is joint with my co-authors, Oriana Bandiera, who's at the LSE and not here, and Scott Lee, who is here. He's a MD, PhD student at Harvard Medical School and Harvard Business School. So I think, you know, and as I say, this has been previous, so the idea here is just that we care a lot about who people are that are delivering these public services delivery in health and education. And a lot of the work has focused on a given set of people and providing the right incentives. But of course, who shows up for these jobs can be tremendously important. And this is a long literature in economics, like who shows up for jobs in general based on the types of jobs that are the types of attributes of the job. And in particular, there is been theoretical work and sort of empirical correlations of surveys showing that, you know, sort of stressing that in public service jobs, you might expect people with greater pro-social motivation to show up for them because they feel aligned, for example, with the mission of the job. So there's some nice theory work by Akerlof-Cranton and Besling-Gatak. And then, you know, when you do surveys, you do find this correlation between pro-social motivation and sort of choosing to be part of these professions. But at the same time, you also find that these professions are relatively low paid, at least compared to, for example, the private sector. And so the fact that you find both pro-social motivation and sort of lower material incentives, you don't really know how these things interact. And in particular, it doesn't tell you whether material incentives, you know, kind of more selfish type incentives, would attract the kind of people who would make public services delivery more effective, and what it would do to, for example, their pro-social, the kind of composition of their pro-social motivation. This is particularly important, I think, in health services delivery. And as you'll see in the context we're going to be studying, which is community health workers. I'll tell you a lot more about this context, but as many of you know who are in this field, community health workers are one of the major ways in which people in remote areas get care. And there's a huge controversy around how much to provide career and other material incentives to them, precisely because of the worry of this trade-off. And so what we do in this national experiment with the government of Zambia is to test how career incentives affect the pool of candidates who show up for these types of jobs. And through selection, how it affects their performance in delivering these health services. And we do this in the context of a National Community Health Assistant program that was a new program that the government of Zambia was launching to address some of the needs in health services delivery. And I'll tell you a little bit more about the context in a second, but just to say that, you know, whenever we try to think about the effect of selection on services delivery, it's really hard. And this question is a particularly hard one, because when you change incentives, you're going to change both the type of people that show up and their incentives when they're on the job and the kind of effort that they put into the job. And we had this wonderful opportunity with this new job, basically, to be able to vary the point at which what people knew at the point of recruitment and what the attributes of the job were that they were signing up for. And that was at recruitment, so we're able to see how that changes the type of people who show up for the job. And then once they're on the job, everyone has the same incentives. And so their effort is driven by the overall incentives that they are facing, which is the same across both conditions, but also by the type of people who selected into the different types of incentives to begin with. And again, we're able to do this because this is a new cadre, and so the job attributes were not known. So let me tell you a little bit about what this why this arose. And as in many of the contexts that people here work in, there's a huge shortage of skilled workers in this sector. And so this is in Zambia, where there's 12 million people, 646 doctors, for example. Nurses also equally scarcely allocated. Getting care to especially remote areas is even more difficult. So even when you train the nurses and doctors, they either leave the country or stay in the main urban areas. And so the idea is to have these community health workers who actually come from these communities, upskill them, and then have them go back. And in fact, I mean, there's some estimates of about 2 million community health workers around the world, that there's a huge push to increase that to much larger numbers in the next few years. And there's been a push around the world of a kind of formalization, professionalization of this sector. So this community health worker program is part of that whole kind of formalizing and professionalizing community health workers. One thing to note about the context is that these are areas where they're super remote, and so doing actually monitoring and measurement is actually pretty difficult. So that even puts more stress on the type of people who show up and the selection of those people, because measuring their performance and monitoring can be very difficult. So as the government of Zambia was designing this program, there was a key moment, decision point that they had to think about, which was they were thinking about this in the quest to formalize and professionalize this sector and really provide these health services in a more professional way. There was this question of whether to put these community health assistants on government payroll and make them part of the civil service. And on the one side, there was the desire to actually be able to have them move up in the civil service and be able to fill all of the levels of shortages that there were in the human resources sector for health. But there was also a strong fear that this would draw in the wrong kind of person. And I remember the director of human resources saying, what happens if they now see themselves as part of the government? Will they lose their connection to the community? And so, we have a conceptual framework in the paper that I won't talk about, but it's basically this idea of where could this trade-off exist? You could imagine a case where, providing these career incentives draws in higher ability people, but maybe they have worse pro-social preferences, or maybe they put more effort towards other types of kind of influencing activities or corruption, and therefore the actual effect on social output that you might care about is ambiguous. So this was sort of a big question, and we addressed it by the use of this large-scale randomized design. So what we did is take the first phase of this community health assistant program, where the idea was to recruit 2, and by the way, they called them community health assistants rather than community health workers. I'll sort of use that interchangeably, but they changed the name to community health assistant to really stress that this was the professional sector as opposed to the many, many CHWs that are volunteers elsewhere. And the kinds of scope of their activity is really like proto-nurses. They have a year of training, and so it's really, they're providing a lot of nursing type services. So these were recruited from 165 communities out of 48 districts. The other 10 districts in the country are more urban, so they took basically the rural districts. And what we do is we experimentally vary, at the point of recruitment, the salience of how much of this job is providing career incentives and career attributes of the job and versus social attributes. I'll show you exactly how we did that in a second. But just a word about how we did the experiment. So we randomized across the district level. So let me just show you. This is South Africa, Zambia, and then these are the participating districts, so the 48 districts, and then the 165 communities, and in the little red dots. And so we randomized at the district level, but we stratified by the province, or 7 provinces, and rate of high school attainment, because you had to have grade 12 education to be part of this program. And we have a balanced sample on lots of sort of baseline statistics about these areas. So what did we exactly do? Essentially, the way that this was working, this was also one of the first decentralized recruitment experiments. Usually they're centralized and recruited at Lusaka, but because this was trying to draw from the communities themselves, the idea was we created 2 recruitment posters, and this was the main form of information that people got about the program. And half the districts just got boxes of one poster. This is the one poster that made the social benefits of the job salient. And the other half got a poster that made the career benefits salient in the job. So just to say a couple words about this way, so of course there's the big statement of want to serve your community, become a community health worker. And then this is like learn about the most important health issues in your community, gain the skills you need to prevent illness and promote health. Other than the benefits here and the big message here, the qualifications were all the same and the application method and requirements were all the same. This is the career poster, become a community health worker to gain skills and boost your career. Here are the clinical opportunities that you can access. Future career opportunities, clinical officer, nurse, environmental health technologist, become a highly trained member of Zambia's healthcare system, interact with experts in the medical field. Meant to really draw in people who kind of want to have that aspiration. And so these are like I said, these are the same qualifications across all. So grade 12 education with 2 O levels, endorsed by the neighborhood health committee in the place of residence. And it says preference given to women and those who have previous experience. Just a quick preview of the results. This small change, relatively small, it depends on whether you think it's small or big, but this change in the way in which the community health workers were recruited at the point of recruitment led to the career incentives poster in particular led to much more higher qualified applicants, the same level of pro-social preferences, and a pretty large change in performance when they went back to the field, which I'll tell you about on all the kinds of indicators that we've collected so far. I'm going to show you a number of different stages of the program and data from each of these stages, so we think as they're going through it. So there's the first stage of application. And as you saw, these posters, they require applicants to submit their diplomas, their O levels, and I'm going to show you how these applicant pools differ in terms of these proxy measures that we have on ability. And then all the applicants who satisfied the requirements came for the second, and the second stage we have is their interviews. Where they came and gave interviews, and there we did candidate surveys with them, and we're able to show you some measures of both pro-social preferences and career preferences, as well as the panel ranks in terms of how the selection panels were ranking the individuals who came in. And then they were selected, and the selection panels chose 2 applicants to send to this 1-year training. And when they came for the 1-year training, once these individuals were already selected, they had been hired for the job, but before they started training, and both groups together were trained together for a year. But before they all started training, we gave them a baseline survey where we did a lot more extensive psychometric scales with them, as well as experimental games in the aspiration of gaining more of these different sort of personality characteristics. And then after that 1 year of training, they went back out in the field. And we've been following them now for 18 months, and we're continually gathering data on them. And I'll tell you about all the performance metrics that we gathered while they've been in the field. OK. I tried to make these bigger, but they're still small here. So I'll try to just go through them. The career incentives attract applicants. Well, first important finding is that the career incentives attract applicants with higher mean ability. And this is particularly important. So you can see that the career, or I will show you that the career applicants qualify for university admission as a 76% rate versus a 71% rate in the social condition. Importantly, in the O levels, so this O levels are a choice. You can decide which subject exams you want to study, and then you have to pass them. And so the O level scores in biology are particularly differentiated across these 2 conditions. And so career guys are just significantly, they're more likely to choose biology, and they're more likely to pass it. Yeah?
It's, given the nature of the poster, you think it's because of the aspiration they had, or do you think because they misperceived the qualifications that were required? Because all the qualifications required are the same. See, if people didn't pay attention to the fine print, they could have thought, but I'm never going to be a nurse. I'm not going to qualify as a nurse. So.
I'll show you that it's interesting here in the sense that, people, so importantly, you didn't get, what you would see, I think, in that story is the left-hand side of the tail being different in the career treatment and the social treatment. In other words, people with lower qualifications wouldn't apply at all in the career treatment, but they would be more likely to apply in the social treatment. We don't actually find that. We find that they're sort of applying at the same rate, whereas what we really find the differences are coming from, those mean differences are really coming from the right-hand side of the tail, which is really about these the sort of high-performing guys, the ones who did sort of the best at the high O-level scores, and in particular the ones at the 95th percentile and the ones at the 90th percentile, who are really driving this difference in means comes up. And so that's just on the ability, but as we mentioned, it could be that that difference in ability could come at a cost of prosocial preferences, and so we also try to measure the preferences. Now that's a very difficult exercise, so that's challenging, but what we do is we measure them at both stages. And you want that because there's trade-offs at both stages. So at the interview stage, you can imagine people will just say whatever they think will get them the job. And so in a way, the way you want to think about the measures we have at the interview stage are a little bit like a manipulation check. What did people think that the posters were revealing about what would be valued in the job? At the same time, you might think, well, there's different measures basically at the interview stage and then at the trained stage. At the trained stage, these are less likely to be gamed in any way. So it's kind of costly to give up money that you've been given for a dictator game, and you can see there's very large variation there. And we use these psychometric scales that have been used in the organizational behavior literature. I'll kind of skip some of this, but if anyone ever wants to talk about these different measures we use, this is an inclusion of others in self measure that is often used here. And there we find that 84% of candidates in both conditions are likely to say that they include the community in their sense of self most strongly. This is at the stage of just the job interview, by the way. And we also look at their kind of community attachment, which we try to get in different ways. So whether they aim to remain in the community in 5 years' time is the same across both conditions. How many groups they belong to, sort of any standard social capital measures, those are the same across both conditions. And so we have about 1,600 of those interview applicants. By the way, the same number of applicants in both showed up for both the career and community treatment. But this is and they had the same level of prosocial preferences. And then we look at, when they arrive for training, we do an adapted dictator game with them, which has been found in other studies, for example, on nurses in South Africa to predict taking on hardship posts. And so we do this adaptive dictator game with them and a whole bunch of psychometric scales. And again, on all of these measures, the applicant pool is the same across the social condition and the career treatment. However, you could really make the argument that there's not much at stake at saying we care about the community. So, a lot of what, and by the way, this is the same as many other have found, but especially this experiment where they increased the salaries. And at the point of selection, they found both higher ability and sort of on different measures of prosocial motivation, but sort of same prosocial motivation on this. Okay, so just if we look at career preferences, yeah.
How strongly are they positively correlated with your measures of performance?
Not much. Not much. Now, that's a little tough. I mean, it's a question of to what degree those are great measures in themselves, how much noise there is, but if you put them in, they're not explaining a lot of the R squared, and they're not decreasing the coefficient on the treatment condition, for example, or all the sort of standard ways.
If they're no big difference,
right.
You at least want them to be good attributes.
Yeah, and I think, these ones, which I'm going to show you in a second, are more correlated, the ones where you really have to make that trade-off and how important is it, where you have this budget constraint where you really have to think about it. But they're not as much as one would have thought, so for whatever that's worth. We then look at career aspirations. And what we find is, indeed, these are actually quite different across the two conditions. That in the career treatment was successful in drawing in people who were more likely to aim to be a higher ranked health professional in 5 to 10 years, which they would say in the job interview. But then also at training, we did a psychometric scale on career orientation that has been validated across lots of conditions to be correlated with people's career choices, and those were also significantly different. Okay, and then we did we tried to really put a budget constraint on people, and what we said is we all have a mix of motivations. So if you had to think about what was driving you when you applied for this job, here are 50 beans. How would you put them across these different attributes of what might draw you to a job? So pays well, allows me to serve the community, good future career, offers stable income. And there we find that having to make this trade-off, you see that those same people that have been drawn in to have high career preferences, but also high pro-social preferences, when they're asked what one was more important, they will say career preferences. So they're more likely to say that. In both the overall kind of allocation of beans, as well as, in the one question that says sort of is your main goal in taking this job service to the community or career advancement? And so you do see this trade-off, and that suggests that, once you think about these guys going back in the field, that there could be a trade-off in terms of the effort that they put on the job, just driven by the type of person they are. That they may, if they only had 1 unit of effort, put more energy into some of these more career-orienting tasks rather than what we might be worried about in terms of pro-social motivation. And so we find that they're different on that dimension, higher skills, but similar on a whole host of other dimensions: share of women, relevant experience, et cetera. Okay, have like 10 minutes, so I'm gonna basically skip over this part, but just for us to think, okay, why, what we really want to be able to identify is selection through this recruitment process, and in particular, self-selection. And so we also want to rule out that, for example, selection by panels is not affecting that. Now, if it were, then it's just selection overall, but we find evidence that it's not the case, that candidate panels are putting different emphasis on different traits, for example, across these two conditions. We also want to make sure that there's not some kind of weird behavioral effect that once people learn that the job actually has both attributes instead of just one, that they would be more demotivated, for example, or more likely to drop out. And we find evidence that that's not the case. So I'm going to go now to the performance metrics, so we can spend the majority of the rest of the time on the performance of these community health assistants. Yeah.
CHW, but you mentioned earlier on that it was in fact built and differentiated between CHWs and CHAs. Yeah. But most of it still used.
Yeah, that's because it was at the very beginning. So once they formalized them, sent them back, put them on the government payroll, then they called them CHAs. But that was just later on in the process.
And when they were employed, they recognized themselves as, they distinguished themselves from the regular.
Yeah, exactly. So there are 3 main tasks that the community health assistants, the CHAs, have. The first one, and it's kind of the most important, given especially the lack of care in these remote areas, is visiting households in the catchment areas. And as I mentioned, they've been trained for a year, so they actually knew how to do some basic diagnosis and treatment, referring sick members to health centers, and they did hygiene inspections. And then sort of their secondary tasks were assisting the staff at the health post and seeing patients, doing antenatal visits, for example, as well as doing community mobilization meetings. And those were immunization campaigns, health education, et cetera. And so I'm going to show you performance metrics on all of these. And just a slight word about the context. Probably I don't need to say it for this audience, but these are really low density areas and very remote. So just take an area the size of Manhattan, for example, 78 square kilometers, that has 200 households. So these guys have to walk very far, often under very bad condition roads that might be rained out or not, to be able to find a household, plan to visit that household, potentially repeat visit that household, et cetera. And they either walk or use bikes. And so, roads that are 10 kilometers take between 1.5 and 4.5 hours to traverse on the bike itself. And so that's one of the major challenges. As you're thinking about the household visit performance metrics, to just understand sort of how difficult it is to get care to these areas and to plan for those visits and do those. So this is how we measured this sort of really important task of doing these visits. And we wanted to get 2 different complementary measures. And Scott was really extraordinary at coming up with this, in particular, lots of different mobile health measures where, this was basically a triple carbon copied receipt book that CHAs used, that they would give to, and the Ministry of Health wanted to call these households clients. And the CHODs like that too, because it was part of their professionalizing of the sector. And so the client would actually sign here, and their name was here, and the start time and end time and date were text to us. And there would be an audit done of some proportion of the clients, whether they were actually visited. So we know, how many were visited and the duration of visits. And then we also use the Health Management and Information System, which is the official government records for reporting, which the CHODs actually, part of their responsibility was to report all of these measures into the government health system. So the first major finding on performance is that career incentives attract agents who do 30% more, 29% more visits using this receipt data. And so that's, on average, 94 more visits, which actually, given the amount of community health assistants, so if you take the 147 community health assistants who were put into the social treatment and you put them in the career treatment, it turns out to be a lot of visits that could have been done if everyone was recruited with the career incentives. And then we look to the HMIS data, which is really reassuringly quite similar. So the HMIS data is aggregated across the two CHODs. As you remember, there was two CHODs in each health post, and they were facing the same treatment because the treatment was at the district level. And so, you get 189 more visits around the same proportion. And then when we look at the distribution of the CHODs in terms of their performance, we see again this pattern where this difference in means is being driven by a right tail of people who are just really good at this job. Now, this right tail isn't fully explained by the ability differential that I showed you in the applicant pool. Because when you control for ability, when you control for the distribution of ability, when you look at performance, it really looks like, that explains something, but it's really about an unobservable quality that appeared to be selected in and led to this difference in performance. And this is just another way of showing it, the quantile regressions. So then we can look, one thing you might worry about is, okay, well, great, they're doing a lot more household visits. I'm going to show you some things that show robustness on different things you might worry about in terms of, but could be crowding out some of the more important other tasks that they're undertaking, so the other important tasks. So they're also doing twice as many community mobilization meetings when they were attracted by the career incentives poster. So they do about 23 more meetings. And they see around the same number of patients at the health post. So it's not actually crowding out the number of patients they see, for example, for antenatal visits. I'll show you some time use data that we collected about what they're doing during these visits. But certainly in terms of the numbers they see, it's the same with more meetings. And so we want to take like one more thing to think, okay, well, does this necessarily mean that career incentives, agents that are recruited by career incentives just perform better? And you might worry about lots of things, which we won't talk about because I have very little time left. But you might worry that they're, strategically making up the data, or more likely to do that, or that it's coming at the cost of a lot of other things. So let me just very quickly go through some of these more robustness checks. So you might be worried that they'll be more likely to cheat, but there has to be a kind of falsifying of these signatures in order to be able to cheat. And this combination of the government data and the receipt data gives us some reassurance that this isn't about cheating. Yeah.
Another typical would be that they are working really hard the first year, but then once they become promoted to nurse, they just stop working hard. Yeah, that's possible. What we have is at least over the time period until none of them have been promoted yet, right? So it's 18 months. At 2 years' time, they can apply for other jobs. So there isn't any kind of time differential. So at 3 months, 6 months, 12 months, 18 months, same differences across treatment. Once they've reached some career potential, maybe. Yeah, no, I think we plan to. But I think it's interesting because the title of the paper is now called Do-Gooders and Go-Getters, because we were trying to think, who are these people? Like, who are these people who seem to have really strong pro-social preferences but also really strong career ambition?
Are they just ladder climbers, or are they kind of people who are just go-getters in general? And then once you've selected for them, similar to like tenure, then people are still going to be productive, you know? And so that, I think that's just a question. OK, so just a quick thing on compensating mechanisms. They don't focus on easy-to-reach households. They, let me show you. They do more unique households and more frequent visits, okay, in the career incentives. They spend the same amount of time in the visits themselves, and they target the same number of women and children. So they're not just targeting kind of the easiest guy to talk to, for example. They're doing the same number of hours work. Now I'm going to give you this time use data is a little like it's based on beans, it's based on recollection, so it's not great, but at least it sort of reassures you that they're not trying to like work that system or strategically game that. They report having the same frequency of out-of-hours calls. And during their time, that reveals a bit about where this time is going. So for example, the career guys report spending less time filling out forms, but they have the same number of completed forms. So they're just essentially more efficient at the process of doing this work. And that's the same at the health post. But the career incentives CHAs spend a larger share of their time on antenatal visits and on antenatal care and maintenance. This is at the household level, too, in terms of just sort of the different things that they do during at the household and at the health post. OK, this is just over time, this result that I was saying that we might be worried about. And then finally, retention. So after 1 year's time, actually, so up to 1 year, they're bound to the government because of all the training that the government invested in them. Not clear exactly how that would be enforced, but there was this thing. So we wanted to check at 1 year's time, were they more likely to drop out? And that's not the case either. So retention is the same. And so what we find is that these career incentives attract candidates who are highly qualified, pro-socially motivated, they perform better in the field without a cost to retention. And right now, we're doing a household survey to look at all these other factors in terms of communication skills as well as different household outcomes and health outcomes. And so in this context, we find that material benefits don't clash with intrinsic motivation or pro-social motivation, and indeed are able to, in some way, select a type of individual that can really do this work well. Now, a couple points just in terms of generalizing this in other contexts. The application requirements of this job, in particular having to get the neighborhood health committee to endorse you, requires some form of connection to the community to begin with. And you know, it's not an easy job. It's not clear you would want to do it if all you cared about was career advancement, for example. You also, I mean, in terms of a welfare perspective and the trade-off for the government, there's a couple things to think about. You could imagine, I mean, in this case, we kept the wages the same across both conditions to be able to really look at just the difference in career incentives. And but you could imagine that you could potentially get people for cheaper if they had more pro-social motivation, if you were only sort of talking about service to the community. So it would be OK if they didn't have higher ability in terms of the overall wage bill for the government. And I think there's this trade-off in terms of, you know, is it better to have a good or great CHA for a year or 2 years and then have to replace them, or is it better to have a kind of mediocre one for a longer period of time? At least the way the government has so far decided to make that trade-off is to decide it would be much better for them to have really good CHAs, even if they end up moving up in the treatment. And so the Ministry of Health now uses the career incentives in this new round of recruitment for the community health assistants. And as I mentioned at the very beginning, this is part of a large sort of collaborative research agenda on a number of different things with regards to health services delivery and recruitment and motivation of health workers. And let me just highlight the two last ones, which we're working on right now. The first is it was actually mentioned before about the amount of autonomy and discretion that health workers might have in their work. And so we're have an experiment in the field right now about the autonomy of choosing your own goals and setting goals. And then the last thing is actually was also brought up about in Pascaline's talk about the potential of nurses and midwives in terms of respect and caring. So the Minister of Health, when he heard about this results, he said, okay, well, you know, this was really done in collaboration with him. And so he said, okay, so we've all done this research. It shows that, you know, we found people in the communities who had these career ambitions. And we provided this thing, kind of upskilled them, and now they care about the community and they're doing this good work. But is there any way to take the people who are already having those career ambitions and are the really high-skilled people and up-care them, basically give them more caring? Because his concern was all of these nurses and doctors who are recruited centrally, who end up being trained in Lusaka, who have a reputation of being not caring. And so that's what we're sort of thinking about next.
John Gruber from MIT will
discuss the
Good, can you hear me? Okay, so I don't have any slides, which is actually consists of my first comment. I wanted to pick a bone with Esther and the JPAL folks for doing a massive disservice to a community that I consider myself a leading representative of, which is the lazy discussant community. The lazy discussant community for years was able to just pick holes in papers because they, with the various empirical identification problems, and it was sort of easy, I could do it in my sleep. And now that I was running experiments, you can't do that. And that makes it harder. Combine that with the fact that was an excellent presentation, which addressed a lot of the comments I was going to make already. So excuse me if I'm somewhat repetitive in my comments. It's obviously a fascinating paper and a really excellent presentation. So the background is something that should appeal to all academics, which is why do people turn down money for pro-social jobs? Okay, and I want to come back to the academic linkages here. In particular, there's two aspects of the question that the paper tests. The first is if monetary incentives are introduced into a pro-social environment, does that crowd out pro-social motivations? And the second is how does the addition of these career incentives affect the quality of these pro-social jobs? If you try to get more pro-career people, do they do less a good job on the pro-social aspect? So the study here is a typical JPAL, super well-designed experiment. You saw the posters. Everything's the same except the picture, the words on the picture in the first block of text. To me, this intervention seems pretty minor. You would think that people who are applying for these jobs who were career-oriented would know they're pretty pro-social. You'd think that the career folks would understand the pro-social aspects. You'd think the pro-social folks would understand the career aspects. I guess ex ante, if you'd said to me, I'm going to change these words on this poster, I would not have predicted a very large effect. But in fact, the effect is enormous. You get a 29% increase in this productivity measure, which is the visits to households. Unfortunately, the presenter did not have enough time to go through the battery of specification checks. This is a real effect. Okay, besides being a well-designed experiment, there's massive number of specification checks of what else could be driving this. This is real. It's a real effect. It's not coming from crowding out other activities or measurement error or other things like that. So basically, I guess I just wanted to follow up this interesting result with a few comments. I guess the first question is sort of how do we think about the reasonableness of effect this large? So basically, in particular, remember, there's in some sense an implicit first stage here, or a 0th stage here, which is who actually found the job through the poster. Okay, so I presume there are other ways to find these jobs. Not everyone found the job through the poster. So already, in some sense, you have to say, okay, a fraction of the people saw the poster. Okay, that fraction of the people, there was then a selection among those fraction of people, and that led to a reduced form effect of a 29% increase in visits. So sort of in some sense, the implicit effect is huge. Another way to think about this is the difference in skill. The measured selection difference in skill between these groups is about 6% difference in the odds of going to college, okay, or the odds of 6%, 6% higher aspiration for career advancement and 8% more likely to qualify for university admission. So there is, in some sense, a real effect here, but that 8% university admission probability is translating to 29% more productivity. So that's pretty amazing, and I think actually, if we try to think about where this is coming from, I think it might be worth exploring a couple of different things. One is, the paper talks about this, it's not a surprise. It's not that people got the job and suddenly realized, wow, I can advance my career, because in some sense they already knew they could advance their career from the poster. But there could be sort of an interaction effect here of kind of, yeah, there are more career-oriented coming in, but then they didn't really realize, oh my God, this is really awesome. This can really promote my career. So in some sense, there's sort of it's kind of like what Esther was talking about with the interaction of the genetics and the environment. There's an interaction of being career-oriented with then the surprise of finding out, wow, I had not realized how incredible this could be for me. And that sort of further boost. It doesn't bias the answers, but it can explain sort of how you can get such huge effects through sort of this multiplier. The other thing that wasn't really discussed, and maybe I missed in the paper because it's a lot of stuff in the paper, was are more visits career advancing? So basically, the people who are career-oriented do more visits. Could that be they're doing more visits because there's actually a marginal return to more visits in terms of the odds they get promoted later on? And so I think that's something I'd like to know more about. And then ultimately, of course, we really like to know more about. It sounds like there'll be more work, and this is what's the effect on health? Ultimately, we want to know, along every observable dimension, these guys are not shirking. They're not selecting. Oh, come on, no one's following the time limits. They're not selecting who they visit and stuff like that. But we'd like to really see what the ultimate outcome is. Okay. Second point is it would be good to examine the heterogeneity of this finding by social preferences. So we see that basically the guys who are more career-oriented are not less socially oriented, okay? But within that career group, what's driving that tail? Who are those folks? I'd like to see a correlation with their pro-social preferences. That right tail of folks that are growing it, I think, would be interesting to see. And because ultimately the question is, since it is sort of a tail of folks, there could be heterogeneity within this group. It could be that, yes, on average, the pro-social preferences are the same among the treatment and control, but the set of folks who drive your result are the folks who aren't pro-social. So I'd like to sort of see that graphed alongside your distribution of effects. Then I think my remaining suggestions are more just things that are probably impossible to do, but you give me an impossible job, I'll make impossible suggestions. So for example, I think that it'd be great if you could do other rounds of this, maybe in other countries, to try to explore more of this treatment. So for example, obviously one thing you'd love to do is have a third box which adds irrelevant information and see how that affects things. That's obviously something you'd love to have done. What if you talk more directly about financial benefits and not just vague comments about career advancement? To what extent would that further get the go-getters, or would that crowd out the do-gooders? And also, what if it's not true that the amount of visits you do affects the odds you get promoted? What if you made it true? What if you made it true that you actually tied pay to performance in this context? How does that affect the sort of do-gooders versus the go-getters? Also, what would be interesting is, if you could once again run this again, it'd be really interesting to see what happens, have a small sign-up bonus. Not just change the poster, but actually for some people they got a little bit of money for signing up. Would that still attract the do-gooders, or would that crowd them out? So I think trying to play with that margin would be very interesting. The other point, you mentioned this quickly, which I think could be very interesting, is what's the downside here? And in particular, what is this crowding out? What else would these people have done? So are we crowding out just overqualified farmers, in which case we're fine with doing this? Or are we crowding out people who would have gone and done something else very productive? And so I think trying to look, now that's pretty hard because, then there's sort of like a general equilibrium effect. That's the downside of experiments. It's hard to measure general equilibrium effects. But that's something that would be really interesting to try to learn about. Maybe one way to look at this would be to look at people who didn't make the cut. Remember, this presentation was fast, but many, many more people applied than actually got in. So if you look at people who didn't make the cut in the two different treatment arms and see what they went and did, then that might actually give you some information about what it is that you're crowding out. So it kind of be like a waiting list kind of identification strategy. So I think that would be really, really interesting to try to explore. I think that trying to, you really do want to take this to welfare, as you talked about at the end. And I think one aspect to take into welfare is trying to understand what the welfare cost, what the alternative thing these people could have done was. I think the other big aspect talking to welfare, and the last point I want to talk about, which was raised by Pascaline's question and by your presentation, which is sort of what are the long-run implications of this for the workforce? To what extent do these people actually continue to provide more social value? Or, especially if there's some implicit link between early performance and promotion, once they get promoted, do they do less? I think academics is obviously an interesting parallel here. One time, shortly after I got tenure, my friend sent me an email about a starfish that apparently roams the sea until it finds where it's going to live and then latches on and eats its own brain. And he said, sounds kind of like tenure. You know, the issue we want to think about is kind of once they get in these positions, are they continuing to work as hard? And I think academic economists are kind of a worrying trend here, right? Because if you think about it, as economists age, they do tend to do more money-making activities and less research. I mean, that's not always true, but it's hard to find examples of people who do less consulting and more research as they get older, right? Not everyone does more consulting, but it's pretty hard to find the converse. A lot of people do more money-making activity. Now, why is that? There could be a lot of reasons. The marginal return to consulting gets higher as you're more established. It could be the spending needs grow with age. Your kids are going to college, you need the money. It could be that, quite frankly, research is super hard and a lot of consulting isn't. Okay? So basically, the bottom line is, and the truth is, as these people get promoted, it may be these visits. I mean, 4 hours on a road to get 10 kilometers, that's insane. I mean, you know, these people who are more career-oriented may say, okay, I've kind of made the next step, and now I'm going to eat my brain. I'm going to cash in. And so I think clearly, for the welfare analysis project, understanding the long run is so critical, and following these people along is so critical. I'm guessing these are just ambitious people who continue to do good and move up the ladder. But I think ultimately, sort of when you want to put the welfare effects on this, it's both looking at what the other opportunities were and what the long run aspects are. So thank you.
Questions stand between the people and that.
I think maybe I can make a quick comment. Thank you very much, Nava, for that talk and for the comments there. You know, this is really, for global health delivery, this is of essence that these questions need to be understood well in terms of that we really begin to understand very clearly what is the impact of the cadre of health workers that we use to deliver the last mile of healthcare, especially in these remote areas. I was just thinking aloud, I was just thinking that it would be just as important to think through the same cadre of health workers in urban settings, because increasingly in many of these areas, it's not just remoteness that is your biggest challenge or access, but it's also now just the overwhelming population density in urban centers, not of just the largest sites, but also these second-tier and third-tier cities, as the Indian government categorizing them. I think this is as an important question there as it might be in these remote areas.
Do you have a sense of how many of these people are likely to actually get promoted, and whether so you don't have data on that yet, but is this how real is the opportunity to advance, and what kinds of things would they look at when evaluating who should go on to higher opportunity jobs?
Yeah. Should I answer now, or because I'd love to answer some of the comments too.
Yeah, you can do
this round.
John and
So let me answer that actually with the comments, and thank you very much for the great comments. Let me first talk about sort of the career promotion process, because John, you also brought that up. So there's no explicit performance based on number of visits or meetings or anything else. Of course, like in any system where you do the thing that's measured, and so there's that sense. But there's not an explicit, like they have supervisors and they have the Ministry of Health. Of course, they're sending this data over. They don't know who sees that, if that's related to the person who's going to be part of their promotion. And the promotion process itself is relatively vague. I think almost intentionally so. There's a lot of opaqueness around how people actually get promoted within the government. So is it, that you meet the traveling district medical officer and you make sure that you're around when he's around? Or is it, that you take these exams and then you get a letter of recommendation from your supervisor? Those things are a bit opaque. Now, you do have to take exams just like everyone else, but there's particular access that you might have to jobs that you wouldn't have because you're now part of the government. Maybe I'll mention a couple of the other things that you brought up, John, in terms of the welfare implications. So the first is just looking at the outside opportunities and what we're crowding out. So we have a table just looking at what were these people doing before. That's the first thing we can look at. And indeed, most of them are farmers, well-educated farmers, as you point out. But the career incentives poster did bring in people that had slightly better outside options, in particular who were more likely to be traders or teachers. Small proportion, but still. So when you think about scaling it, right now it's like 2 people, but when you think about scaling it, I think it is a serious thing to think about what is it cropping up. And certainly we can look now at what those other candidates are doing. And the long-run implications are things that we can also look at. Let me think if there's anything. Oh, the reasonableness of the effect. You know, when you look at the incentive studies, the ones that have worked in terms of paper performance, for example, there's a kind of 30% increase in, for example, showing up for class for teachers, or other types of paper performance incentive changes in providing workers. I don't know. So I think a 30% change is in.
That almost makes me a little bit more suspicious, right? Because that's actually paying. If paying is 30%, that's both selection and marginal reimbursement. Whereas here, you're just selection based on what's on a poster. So doesn't that make it?
Well,
make
but I think it
big,
depends.
right?
We never know. That 30% change isn't usually. I mean, that's selection and.
We don't know which margin.
We don't know which margin it is, and you know, I think the point of our paper is that the selection margin is much bigger than we may have previously thought. You know. And the interaction thing, I think, you know, we have this assumption that once people, so for example, you get the career poster thing, and that's the career incentives you think, those are pretty much the career incentives that you learn about, that the other career treatment learns about. The idea that you would learn that they were even more than what you had thought in the career treatment, it might be there may be some interaction, but I think at the most, what is in the career treatment poster is what both the career treatment and the social treatment guys learn about when they come onto the thing. And then the other things we'll definitely talk about because they're really great.
Okay, so one